Hello and welcome to UnHerd News. I'm Freddie Sayers. Something is happening over in China. The Chinese Communist Party's so-called zero COVID strategy has provided the world with some of the most extreme and distressing images of the pandemic era. During the lockdowns of 2020 and 2021, even into 2022, we were getting strange glimpses over social media of the bizarre and sometimes dystopian lengths the CCP would go to fight against community spread of COVID. Let's just refresh our minds by taking a look at some of them. Armies of officials in hazmat suits trying to disinfect a street. The same thing happening on a motorcycle in a city. A young child in some kind of quarantine facility being delivered food through a locked cubicle. Another child so used to having his temperature taken and opening his mouth to be tested for COVID that he does it automatically. Families arriving at quarantine centres with their luggage all wrapped up in special disinfectant wrappers, being sprayed and hosed down as they arrive. And drones blaring into blocks of apartments with the latest COVID guidance of what you can and can't do. These are just some of the images we've got used to over the last couple of years. And then at last month's Communist Party Congress, which is one of these strange events which just rubber stamps things rather than actually debates everything, because of course it's not a democracy, it was widely reported that the president, Xi Jinping, had doubled down on the COVID-0 approach and that those draconian measures were here to stay. China Congress, Xi Jinping doubles down on zero COVID as the meeting opens, reported BBC News. As China doubles down on zero COVID, some have had enough, reported Al Jazeera. China doubles down on zero COVID policy, said London's City AM. But then, a few weeks later, at the end of last week, the Standing Committee of the Politburo of the Chinese Communist Party put out a document which apparently developed and affirmed the zero COVID policy, but in doing so made a list of 20 amendments. This is coming out of something called the National Health Commission of the People's Republic of China. But in amongst the detail of this document that sounds just like a bureaucratic piece of information, there are some quite important shifts. The rhetoric is all about continuing the zero COVID policy, implementing President Xi's continued agenda for the safety of the people. But in terms of practical changes, there are some that we spotted that are quite significant. First, Amendment 2 says that China will no longer track close contacts of an infected person, which you might think is just common sense. Why would you be doing that anyway? But in combination with another amendment that suddenly allows home quarantining for people even in high-risk areas, the message is actually quite clear. The numbers of people being taken to these quarantine centres, which have sprung up across China, including a very large number of people who didn't even have COVID at all, is clearly something that is on the minds of the Chinese government. It is being rolled out to reduce the numbers of people going in. You might remember when we spoke to one of those people actually detained in a quarantine centre, she took us on a tour within Beijing of what these places actually look like. Let's have a look. You see just rows and rows of cubicles in a vast centre with people with makeshift beds just living there, and she told us about the very, very tiny amount of freedom she was getting. So from this change, it might not seem much, but we can deduce two things. First of all, the Chinese regime, even in this most compliant country, is becoming aware that their population don't like it. And second of all, that the government, even though there's no democracy, is feeling nervous enough that they have to start changing the policy. They don't want so many innocent people, uninfected people, going into these camps. Further down the Politburo's announcement is Amendment 14. Here they promise to, quote, identify the population of elderly, patients with underlying diseases, pregnant women, and other vulnerable groups, and to formulate health and safety protection plans for them. Later in the same amendment, they promise to optimize the management of places where these vulnerable groups are concentrated, such as nursing homes. That's from the National Health Commission's statement. Well, hold on a moment. Where have we heard this before? You might remember in the autumn of 2020, we spoke to 3 doctors, Sunetra Gupta, Jay Bhattacharya, and Martin Kulldorff, who had written something called the Great Barrington Declaration. At the time, it was widely dismissed by the establishment. It was considered extraordinarily controversial, but their principle sounded a little bit like what has just gone out from the Chinese Communist Party. Their principle said they wanted focused protection instead of a one-size-fits-all solution. This is a quote. "Adopting measures to protect the vulnerable should be the central aim of public health responses to COVID-19. By way of example, nursing homes should use staff with acquired immunity and perform frequent testing of other staff and all visitors." So the Chinese Communist Party actually, 2 years later, seems to be inching in the direction that those doctors suggested all that time ago. Let's just remind ourselves, because we broke the story here at UnHerd of the Great Barrington Declaration, how Professor Sunetra Gupta, one of the 3 doctors, described it in Great Barrington, Massachusetts.
Our intention of putting on the table an alternative strategy for dealing with the current crisis, which protects the vulnerable, but at the same time allows us to minimize the damage done, particularly to the young and the disadvantaged sectors of our population. And that strategy essentially consists of shielding the vulnerable, or investing quite seriously in finding ways to protect the vulnerable, those in care homes, obviously, and stopping infections in hospitals, but also more generally in the community.
So the central argument is that the one-size-fits-all approach, where everyone should be treated the same, was wrong and was going to cause damage, but something which they described as focused protection would have been better. And that sounds a little bit like what the Chinese government is now talking about. Further down in the same document, what they call Amendment 16, this language becomes even more explicit. "We shall increase efforts to correct, quote, one-size-fits-all approaches. It is strictly forbidden to close schools and classes, stop work and production, restrict traffic without approval, introduce unapproved lockdowns or remain in lockdowns for overly long periods, and other kinds of exaggerated behaviors such as random suspension of diagnosis and medical treatments will result in increased notification and public exposure, leading to severe punishment for those local authorities that cause those serious consequences." Let's just let that sink in. This is the Central Communist Party of the People's Republic of China sending out a message to local governments and local government agencies saying that a one-size-fits-all approach to COVID is no longer acceptable, and that they're actually threatening to discipline errant local government agencies that ignore that and do some of these exaggerated behaviors. It's a major philosophical breakthrough. 2 years too late, you might well say. Zero COVID, if it is anything, is a one-size-fits-all philosophy. The whole aim is to say there is no acceptable level of COVID in any population. Stringent suppression measures need to be used across the whole population if the virus is spreading at all, in order to protect everybody. That is the principle, and zero COVID is all about that one-size-fits-all goal. Let's just remind ourselves of what Devi Sridhar, this is a professor here in the UK, she's out of the University of Edinburgh, who was one of the professors during the pandemic who had more airtime than any other. She was on the BBC, on Piers Morgan, on ITV, on Channel 4. She was an enormously popular commentator and one of the big champions of the zero COVID movement. I interviewed her back in 2020, and this is how she defined it.
Give me a sort of summary of what zero COVID actually means.
Well, what it means is there's no acceptable incidence of this virus and that there's a continual push to zero. Will we see zero cases for a prolonged period? Probably not, because there's a global pandemic and it's taking off. Every day, new daily records are being set. But it says within national borders, where countries can have some control of this virus, trying to have maximum suppression. I think some countries either have given up or who have said if we stay within NHS capacity or health services capacity, it'll be fine. But I think it's saying, well, actually, everything we've seen from this virus over the past couple months, meaning if you want to get back to some kind of normality in daily life and you want to protect those who are shielding and you want to get schools open, there's no getting around really tightly controlling this virus.
Just listen to the language there. No acceptable incidence of the virus. She implied that countries were giving up if they allowed any level of the virus, and therefore maximum suppression is what she called it. Tightly controlling this virus is the only moral policy. Well, clearly that has described what China has been trying to do for a lot of the past 2 years, but even they appear to be changing their minds. It's always confusing what's actually happening in a country like China. There's very little communication and very little information that you can rely on. But we felt it was important to mark this because it's a major moment. This argument has raged for years. China, let's not forget, was the original source of the whole concept that you could shut down the whole of society in pursuit of some kind of virus suppression. There was an interview with Professor Neil Ferguson, which we wrote about on UnHerd in December of 2020, where he actually described the genesis of that example. I think people's sense of what is possible, says Professor Neil Ferguson, in terms of control changed quite dramatically between January and March 2020, when SAGE observed the, quote, innovative intervention out of China, that is, locking entire communities down and not permitting them to leave their homes. They initially presumed it would not be an available option in a liberal Western democracy. Quote, it's a communist one-party state, we said. We couldn't get away with it in Europe, we thought. And then Italy did it, and we realized we could. Now, clearly it's not going to stop overnight, the COVID policy in China. It's actually highly useful for their very authoritarian purposes to have all of these QR codes and procedures of centralized control. Also, they have very little natural immunity and are terrified of what comes next if the virus does increase. So life in China will continue to be interrupted and full of these endless interventions and insecurities. But let the record show that November 2022 was when the Chinese government quietly began to abandon the central principles of their zero COVID policy. This is an idea that has been one of the greatest government experiments of all of our lives. It ricocheted across the Western world and across the whole world. It was pushed by highly respectable, highly lauded scientists and extremely influential Western government leaders, all of whom agreed that the wise way to run society, the morally acceptable way to run society, was to change the way everyone lived and go for minimal spread of a virus by maximum suppression. And now, even the Communist Party of China no longer thinks that's a good idea. Thanks for tuning in. This was UnHerd.